Hi, I'm Lori Ferris. I'm a woundostomy nurse at UMS, and I have a background in neurosurgical nursing as well. And currently been asked to speak to you about medical marijuana. It's not my big topic of knowledge, but here it goes. As you know, it has different names from cannabis, pot, weed, skunk, rope, herb, just to name a few. It's a product that can be smoked, it can be vaporized, it can be baked, eaten, or even drank. The term medical marijuana is referring to what's called utilizing the whole unprocessed plant and its base extracts to treat a symptom or a disease. And so that way it is not utilized or grown with pesticides and things like that. It's regulated, and that's what Arkansas is looking to do, is how to regulate these places that are going to dispense medical marijuana. It is not an FDA approved product as well, which is important to know. And the reason for that is that you have to have big clinical trials with patient populations, which have not been occurred, probably because of the legality of it. And the other issue is clinical trials, they need a product that has a uniform dose of measurement, or the way it's dispensed, like in a pill, an injection, or a liquid, and it's not easily to get that equalized in medical marijuana. So those are the two factors that affect FDA approval. But however, within medical marijuana, there is this extract called cannabinoids, and that product has had an enticing factor of it because there's over 100 of them, and out of that there are two that have had scientific interest and utilization, and where pills have been made synthetically, and those are called Marinol is one and Nabinol is another one, and those are based out of the cannabinoids, and they are FDA approved, and they're used for nausea and appetite stimulation. So as I said, there's over 100 cannabinoid extracts or more that can be formulated out of them, but the two main ones that have come out is one that's called Delta 9 tetrahydrocannabinol, or known as THC, is the bottom line of that. And this one is the FDA approval that has been utilized because it's been synthesized down. It used to increase appetite, decrease nausea. HIV victims and cancer patients are the ones that utilize this a lot, or failure to thrive patients. It does play a role in decreasing pain, inflammation, and muscle control. Another product of the cannabinoids that have been synthesized out is something called CBD, and it is used in treating childhood epilepsy, and that's the big attraction to that. It's mainly in a liquid form that's been utilized for this treatment. It also has some thought to help reduce pain and inflammation. It doesn't have the desirable effects as THC does, in that it doesn't alter the mood or the behavior quite like the other one does. So what is the importance of this? THC, the attraction to that is it stimulates the neurotransmitters that are in the brain cells that are naturally occurring in all of us, and there's also some other cells within the body, the liver, and different places that are called endocannabinoids. And what they do is they're part of the neural connection in the communication network, and what happens is they influence concentration, memory, thinking, as well as affecting movement. They, in terms of coordinated movement, and they also can affect THC on the centers that affect the appetite, as well as pain and vomiting reflex.